I'm Sanj, Srikanthan, a non-executive member of the Integrated Care Board, and I'm also chairing the Finance, Performance and Commissioning Committee of that board.
And today's been a very packed day of lots of things to discuss and see as a board. We've talked about the joint operating plan, we talked about the new intermediate care strategy. We've also agreed and looked at virtual wards, as well as our performance too. What's been your highlight from today's meeting?
I think the really important thing about this morning has been the intermediate care strategy, and what that means to people listening to this is how do we ensure that we minimise the number of people who need to go into hospital and really provide as much care as necessary at place level, by which we mean anywhere but the hospital, communities with your GP, but also the responsibility we all can take to improve our health and our well-being so that we put less of a tax on the system.
No, it's really, really important. It's all about providing the right care at the right time and the right place. Why is it so important to do that and to avoid people going into hospitals?
Well, we've got about 225,000 people in Cornwall who could be managing their health really effectively so that the system, the hospitals and the NHS here in Cornwall can focus on maybe about 25,000 who need much more developed care because they're at a point in their life where it's no longer possible just by being more healthy to look after themselves. So what we're asking for is that majority to really help us through what we can do at community and through prevention to be healthier and lead better lives for themselves as well.
We also know that people do better at home, don't they, than in a hospital setting. So it's also preferred. Just sort of looking ahead as well, we've been hearing today about our personal experiences of people and staff across the system. We show every month 5 films, and they're also on our website. It's really, really important for us to get that patient voice. What did you hear and really enjoy listening to today's from the personal experiences we showed?
There's some really wonderful stories to look at, and I'm glad they're going to be on our website if people want to look themselves. I think what I really saw was that theme of taking ownership at place level. So we had stories around swimming to improve health outcomes, about really digital services being rolled out by actually my local practice, Probus Surgery. And we also heard about the challenges of COVID vaccinations and the complications when you're taking other medication. And we need to communicate more effectively about how you can manage your own health. And I think these vignettes give real life examples of people facing real life challenges and how the system can help them, but also how volunteers in the community and carers in the community are helping as well.
No, that's really good. And it's interesting that Probus Surgery, on your own pact, was featured, and it sounds like they're doing some impressive things. So we'll be using that and sharing that experience across Cornwall, because we know that access to GP surgery and services is really important for our local people. So thank you very much for your time today, and it's been really lovely to meet you.